Hi, this is Jerry Hesch, and I am from the Hesch Institute in Aurora, Colorado, and I treat the whole body. So I treat neck pain, shoulder pain, thoracic, lumbar, sacroiliac, lower extremity pain. But this presentation is on how to make sitting comfort more tolerable in airports and in airplanes. All right, so on the airplane, sorry, just keep going. We have a dog, it's reality. So on an airplane, you can take a magazine and you can sit on it, and it will reduce the friction of the cloth seats and allow you to get greater freedom of mobility of your pelvis and lumbar spine. You could also use that plastic thing, sheet that tells you what drinks and what food you can order. You could also bring a gallon Ziploc bag and sit on it. And when you do, it is a lot easier for you to do simple exercises to your hips, pelvis, sacroiliac, lumbar spine, but really the whole spine participates, so it's really whole body, okay? The exercises that I recommend are to roll your pelvis forward and backward gently. If one direction is uncomfortable, then you want to emphasize the other direction. And you can do anywhere from 10 to 30 of these. So the first one is forward and backward. And the next one is side to side, okay? And that's a dog chewing a bone, and it is what it is. We have a home office and we live with it. All right, the next one is just going side to side gently, okay? The third one is rotating by bringing one shoulder forward and then the other one forward. And with this one, the pelvis is stable. The next one, we want to get rotational movement of the pelvis. So we want the pelvis going like this, left and right. And the way we do that is we push a knee forward and backward, forward, backward. And it's very easy for that to become, you know, when the left knee is going forward, the right one is actually coming backward at the same time. And if you think about it, it kind of enhances that a little bit. We flew to Europe a couple years ago, I taught, and I set a timer every 45 minutes. And every 45 minutes, I did these exercises, and then I got up and I walked up and down the airplane. So that's what I recommend, and you can do the same thing in the airport, okay? Another thing that I do when I need to sit for longer than, say, an hour at a time is that I make sure that the seated surface, the pan of the chair that you sit in, the seat pan, is higher than my knees, or at least level. How do you know? If it's an appropriate height, it'll be really easy for you to roll your pelvis back and forth, okay? In my office chair, I have my desk elevated a little bit, and I bought an extra tall gas cylinder so I can raise that up and get my hips even a little bit higher than my knees, and that is ideal. I did research on that in 1980 or 81, and that was my senior project when I went to PT school, and I validated that yes, a positive seat slope where the back is higher than the front is more comfortable. And that's when research was coming out of the Scandinavian countries addressing that as well. This I like very much. It's a standing pad to make standing more comfortable. And you can find these at any of the big box hardware stores, okay? You can cut them. This one, I could come up with a total of 3 of these pads. And you can cut them with a serrated knife or a utility knife or a bandsaw. And the other thing you can use that I'm supposed to have close by to me, but I don't know where it is here it is a gardener's kneeling pad. And there's a couple of ways you can use this. Number one, it goes on the back of the seat, and that will elevate your pelvis, hopefully higher than your knees, or at least level, okay? There is another trick of using this, and that is that you can scoot it forward about 2 inches, and then your sit bones are actually hanging off of it, off of the gardener's kneeler pad. What's happening then is the lumbar spine is in a little bit of flexion, and the facet joints are getting a little bit of traction. That's increasing the vertical and the front to back dimension of those openings called neuroforamina, where the nerve roots come out of the spine and come out and branch with others to form the sciatic nerve, etc. Okay? So that's another thing that you can do. Now, there is no perfect posture, so you cannot put yourself in an ideal posture and stay there for 4 hours. There will be consequences, okay? The best posture is the one that allows the greatest amount of mobility. And when I sit on these, on the airplane, I'll sit for, I don't know, an hour or so, hour and a half, and then I'll take them off, okay? So those are my recommendations, but regular exercises is good for everybody, and especially those of us with, symptomatic low back, pelvis, SI hips, And maybe a couple days before your flight, you could ramp up on your exercises. And of course, you can consult your healthcare provider for which ones are ideal. But I'm going to just show you how these exercises I showed you can be replicated on an exercise ball. So the exercise ball the size of it should be based on your height, and you can look that up online. And this one is fairly good for me because my hips are just slightly higher. The next size up, or a little bit more air in it, would be even more additive. If I keep my knees apart, my hips are fairly open and neutral, and you can compare. Can I roll my pelvis back and forth in this ball? Okay. And you can compare what happens if your knees are together. Ugh, extremely difficult and uncomfortable. Most of us find this natural place without even thinking about it. Same thing with standing. And everybody has perhaps a different neutral for their hips. Some people believe your feet have to point forward. And I taught a yoga instructor. She had taught for 20 years. I taught her to find her neutral, which was feet pointing outward slightly. She was astonished at how good that felt. Well, they had drilled it in her head that everybody should be made the same, and that just is not the way the hips are made. So find your own neutral. If bending down and back, doing a squat is comfortable with them pointing straight, wonderful. If it's more comfortable with them pointing out, do it with toes pointing out. All right, find your own truth, because there's a lot of dogma out there. All right, so in the ball, I'm able to roll back and forth, okay? And look how simple, how easy, effortless it is to go sideways. Now let's suppose it was tight going to the left, and every time I went there, it just didn't feel like I was gonna gain motion there. The secret is go the other way. So instead of going left, I would just go right and back to neutral. And I would do between 10 and 30 of those, okay? And then you can come and test going to the left, and it might open up. It might be a few days before it opens up, but it typically does open up soon thereafter, okay? And then now I'm gonna show you that other one where I twist my trunk, okay? And the ball is pretty stable here, okay? And you can even do tiny little motions. I'm twisting left and right, and nobody knows it. So, you know, if you're a little sensitive to people seeing you doing gross movements in an airplane seat, well, just do little tiny ones. They don't have to see that. It's still helpful to you. Okay, and then the other one where I push a knee forward and back, okay, and very quickly it translates to me pushing the left one forward while I pull the right one back. That's just kind of a natural, it just happens very quickly. And so just small movements, just small comfortable movements. And these movements incorporate toes, feet, ankles, knees, hips, pelvis, sacroiliac, lumbar spine, and even your trunk and upper body. The other thing that this can be nice for, I bring two with me. And you can put crushed ice, about a third full, okay? And then you take the air out of it and you Ziploc it. And then you put it in another gallon bag, so that if one should have a little tear in it, the water's not going to leak all over the place, okay? So you take two of these with you when you travel, and at the airport you can load up on some ice and use it on the airplane wherever you're uncomfortable. And I would not use that for more than 10 minutes out of every hour, okay? But that may greatly enhance your comfort. You can even sit on it if you have ischial bursitis, or if you have tailbone pain, you can kind of fold it a little bit, you know, like yay, and then the tailbone goes in there and there's ice on both sides and even a little bit underneath it, okay? So I'm sure that I'll come up with other ideas, and I'll probably think, gee, I should have said this or this. So I'll probably call this part 1, and who knows when a part 2 will emerge. But I hope this is helpful to you, and thank you very much. Also, I am at, I think we have an Amazon package. Those are costly little alarms. So, I forgot my train of thought. I'll stop here. Thank you. Oh, also, I am at Hesch Institute. I treat chronic pain. You can find that typing Hesch, H-E-S like Susie, C as in cat, H as in Henry, Institute, Hesch Institute. And that's also on the top of the video. You can read the disclaimer that you don't read. Thank you very much.